We are going to talk about one of my favorite subjects, and I know that you're going to say, endometriosis is your favorite subject. Why would you want to talk about that? Well, it's because I do have endometriosis, severe endometriosis at that. So I will tell you my experience, but of course, we'll get into the clinical side first, discuss what it is, discuss things that we should probably avoid if we have it. And then, of course, we'll talk a little bit about the program that I created called Divine Woman. It's specifically for women that have hormone imbalance that presents as things like endometriosis. But I have a whole checklist of conditions that fall into that category, endometriosis being one of them. The reason that I wanted to talk about endometriosis in this situation is because it's one of the most common. I will list some other women that have talked about this with me. I will list that in the comments after the video is over, just to give you a good idea of some of the numbers. It's like 1 in 4, and it just seems to progressively get worse. I have my own thought processes on that. You guys know I am not a medical doctor, therefore I cannot treat, I cannot, cure, I cannot do surgery, I cannot prescribe pharmaceuticals. But in functional medicine, things are a lot different. I don't need those avenues to be able to help someone. So being a doctor of functional medicine often means being a teacher instead of being a doctor. And so if we go with the Greek formatting of the word doctor, it means teacher anyway. And that's what I do. That's why people call me Dr. Liv. It's because most people that are into holistic wellness, or they are into some type of other type of wellness other than standardized healthcare, they are someone who enjoys and wants to work with me because they're into natural remedies. We can't discount what was done thousands of years ago to make people well. Is our lifespan longer now? Yes, because all technology has advanced. It is not to blast medical technology or blast the medical field, because obviously if you need it, if you have an appendix that's about to rupture, I'm going to tell you where you need to go, and it's the emergency room, so you can have emergency surgery to have your appendix removed. Don't be silly. That's the point that I'm making. But when it comes to things like hormone imbalance, that's a little bit more delicate, and sometimes going straight for the big gusto of a pharmaceutical is not always the best choice for someone, especially when it is a female that is having something that people do not have a cause or reason for. And to this day, as common as endometriosis is, there is not a doctor in the field that can tell you why we get it. And so my goal is not to find out why we get it, even though I have my thoughts on that. We can talk about that privately. But my course of action and the way that I go after this is the root cause, which is the hormone imbalance. Hormones are out of whack, which are then causing tissues to grow in places that they should not grow. And then those tissues are then affected by those same exact hormones, because your body can't tell the difference between your uterus and the tissue that's grown on it. So, for instance, endometriosis, clinical definition, is a painful disorder in which tissue similar to the tissue that normally lines the insides of your uterus, the endometrium, grows outside of the uterus. Endometriosis most commonly involves your ovaries, fallopian tubes, and tissue lining your pelvis. However, I personally know women that have it around their stomach, their intestines, the colon, spleen. So it can grow anywhere, and it's not really a medical anomaly because it happens more often than we know. And so the first question that everybody always asks me with endometriosis is, what do I do? Like, what do I stop doing? Well, the first thing I want you to realize and understand about this is that it's not your fault. It's not anything that you did necessarily or technically. You just lived a life like any normal person. You got your coffee in the morning before you got up to go to work or start work, however that works for you. You know, you tried to use the artificial sweeteners because you didn't want to be using sugar because people told you that was bad for you too. You've probably used birth control sometime in your life because you didn't want to have children and you were trying to be responsible. And again, you did these things because that's what you thought you were supposed to do. You thought it was right. You thought it was the best thing to do. It was the best thing that you knew to do in that time. Well, after extensive research, because I've literally been researching endometriosis for approximately 20 years. Obviously, I found out about mine when I was about 16. So that's my 20 years of research. But obviously, as I started to go through school and I started to get additional education in the realm of holistic health or functional medicine, I began to apply what I learned in school and apply what I learned in, the functional medicine world to endometriosis, and found out so many things and made so many connections that I wasn't able to make when I was 16, because obviously there were things I didn't know. I didn't have a database with 20,000 different supplements and a bunch of protocols and a resource library to be able to help me. I didn't know what PubMed was to be able to go read research journals and medical journals that are published in the European sector on things like this. And I just started to take in as much information as I possibly could, because much like many of you, I was in a place in my life where I wanted to be well. I wanted to be healthy. This was long before Divine Woman was ever thought of. It wasn't until I fixed myself that I thought or had the confidence to be able to fix other people. So, all right, we know what endometriosis is. Now, let's talk about some of the other things that happen or are a byproduct of endometriosis or happen because you have hormone imbalance. PCOS. Lots of times, PCOS and endometriosis, please ignore my fingernail. I ripped it off at the quick. It hurts really bad. It's so ghetto. But side note, endometriosis, PCOS usually go hand in hand. This is where we're going to see where we start to grow hair under here or around our areola. Very heavy bleeding, very painful, lots of cramps, hormones just completely out of control. We'll also see unexplained infertility, miscarriages, heavy uterine bleeding. And please understand, I'm not saying any of this to be a trigger warning. So if this does make you uncomfortable, come back and watch later, or, give us a little toot toot, say hey, and keep it moving. I completely understand. Abnormal pap smears, a lot of them. Dysplasia or lesions on the cervix, which is normally caused by HPV, but lesions can now show up without HPV. So, like I said, it's such a slippery slope. Hashimoto's, having to do with your thyroid. PMDD, diabetes, Graves' disease, Cushing's syndrome, ovarian cancer, cervical cancer, uterine polyps, fibroids, ovarian cysts, hypothyroidism, hyperthyroidism are all byproducts of hormone imbalance. That is my professional opinion. Yes, they are all byproducts of hormone imbalance. So the only way that we fix these things is not with a pharmaceutical. We fix them with finding out where the hormone imbalance is, which hormone it is, and for us that are all the things I've just listed on here, 9 times out of 10 it's estrogen dominance. And endometriosis, what I have found over the last 20 years is it is absolutely estrogen dominance. We have too much estrogen. And as women, you can't go without producing estrogen, but you can in fact produce too much. And like I always say, balance is everything. We have to keep that estrogen and that progesterone at the same level, because the moment that the estrogen, progesterone, and testosterone get out of order, there's one of them that's higher, whole thing goes, whole ship sinks. And it is very difficult to keep it in balance, but that is what I want to help you with today. Some of the foods we have to avoid, and everybody hates this part because it's things we love. Alcohol, wine, beer, spirits, they can make endometriosis symptoms worse. Caffeine, we should be having 400 milligrams or less. So you're going to have about a cup of coffee a day if it's really strong. In a normal, regular, standard Waffle House, McDonald's cup of coffee, you're going to get about 80 milligrams. So we want to stick at 400. I know that sounds like you could have 3 or 4, but if you over here making espresso blends, you can't have 4. You can only have 1 because the caffeine is higher. And this would also include green teas, black teas, things that have caffeine in them, soda. So it's not just coffee. Really shouldn't be drinking soda anyway, but I understand everybody has their vice. And I don't knock things. I don't do restrictive dieting with my clients because all it does is make you stand in front of the refrigerator at midnight in your underwear with a spoon, digging in the ice cream carton, because you have to have the sweets. We don't do restrictive dieting. It just makes it worse. We have to have a healthy relationship with food. Fatty meats. So if you're somebody who really likes ribeyes for steak, you might want to switch it to something leaner. A filet would be great. Sirloin would be all right, but we don't want super marbly. We don't want super fatty. We don't want to eat the fat off the chicken. We want to keep it lean. So one of the biggest things with endometriosis outside of the food and the way that it actually operates in the body is that the tissues are affected by the hormones, the same exact way that your endometrial tissues are affected by your hormones. So you have a menstrual cycle every month. That menstrual cycle then leads you to be able to have a period. It's usually a 28-day cycle, give or take a few days. Everybody's different. Some people are 32, some people 24. I'm at about 26. It's cool. It's not a problem if it's like that. But every about 28 days, and you go with the cycle of the moon, I have a guide today that I will give you for participating. So at any point during the video, if you say me in the comments and DM me your email address, I will send you it. It has a whole section that talks about the moon, the different type of periods, and when those periods happen throughout the month, and some of the characteristics about you. They're pretty spot on. But what happens is, as your hormones fluctuate throughout the month in order to make this cycle happen, it also affects your tissue that is growing outside of the uterus, including the tissue that's inside the uterus. So when we have a period, we all know, at least I hope we all know, that that is the uterine lining. You're shedding that uterine lining in order to have that period. That's what the period is. And so when you have endometriosis, whatever is surrounding your uterus, your ovaries, your intestines, your stomach, wherever that tissue has gone in the body, it's then going to react to your cycle just like your uterine lining does. And that's what makes it so scary, because you are bleeding in places that you essentially should not be bleeding. Now, hormone changes that occur with the menstrual cycle can make the endometriosis pain worse. And if you are estrogen dominant, and if you have endometriosis, I'm telling you you're estrogen dominant. I do not even have to do a pH test to know that. But if you are estrogen dominant, and estrogen is your main leading hormone, it is going to make that pain worse because you have too much of it. And now it's ramping up. That's why the cramps are so terrible. That's why the bleeding is so heavy. And there are treatments that can help this, like hormone therapy, but a lot of women are very anxious and very just not with that. They don't want to do hormone therapy, especially if they're young, because it can alter your hormone levels and it can honestly stop your body essentially from producing certain hormones that you actually need. So what we would do on a holistic scale is find supplements that we need that are already naturally occurring in the body that you're either not getting enough of, not producing, or not assimilating. And that's where pH testing comes in. If you are a pattern 5 pH, and if you are estrogen dominant with endometriosis, you know, in hormone imbalance, you're most likely going to be a pattern 5 pH as well. And that pattern 5 pH is going to put you in a situation where you're not assimilating any of your nutrients. So typically what I'll see is women that have belly fat around the middle that they cannot get rid of. It doesn't matter what they do unless they starve themselves, which we no. We don't want to do that. But what happens is the hormones take over. Now we've got hormone imbalance. Now we've got endometriosis. Now we've got extra belly fat. Now we feel uncomfortable. Now our confidence is in the toilet and we don't know what else to do. And we're sitting there essentially twiddling thumbs because we've talked to everybody and nobody knows how to fix it other than experimental medications like the Lupron shot that's actually made for prostate cancer patients, or some type of hormonal birth control, which then further puts the hormones out of order or out of whack. And then we end up just frustrated and irritated and not able to function like a normal human and tired because it's day in and day out. And if you're someone that has hormone imbalance and you're someone that has endometriosis, I can tell you exactly how your month goes. This sound about right? Period. Painful. Excruciating. Sickening. Makes you ill. Makes you nauseous. Could make you black out. Could make you not want to be around lights. Could make you have to be in the bathtub 24/7 in the warm water for some type of relief. It could make you have to be in the bed for 2 or 3 days while you're bleeding. Then you stop bleeding. Then your abdomen, which is a little bit swollen, and honestly, people can't even touch it while you're bleeding when you have endo because you're so uncomfortable, your pants are uncomfortable, then that starts to go away. That starts to fade. And then you're kind of chill, you're kind of all right, and then you ovulate. And then you're running all around the place and you are completely, excuse the language, but it's the best way that I can put it in medical terms, you're sexually aroused all day long, all the time, ready to rip clothes off for an entire week. And then comes the week where you're normal. You feel all right. Hormones are kind of in order, even though they're imbalanced, but they're the best that they're going to get. You feel a little bit like yourself. You feel like throwing on the makeup. You feel like putting on a cute outfit. You feel like going out with the girls. And then we're right back around to the week before the period when the PMDD starts, or the severe PMS symptom starts, and everything and everybody is getting on your nerves. You want to punch holes in walls. Everything is aggravating you, even the people that you love the most and hold the most dear. And then you start your period, and then you feel awful. So that's the cycle that most women go through. And again, 1 in 4. This causes infertility in a lot of women. So I think that this is a great way to go into the segue of my own story. I started with Bartholin gland cysts. If you're not familiar with the Bartholin gland, it is the gland that produces female lubrication. It is in the inside labia, and they're about the size of an almond. They're really thin, they're really small, and they're there specifically for that purpose, no other purpose. Well, sometimes those glands can have cysts, and they can create cysts, and then those cysts become infected, and then the gland becomes infected, and then after that happens so many times, you have to have it surgically removed because it's out of order. It's not operational. It's just going to continue to give you a cyst. I would get cysts, and they would swell to the size of softballs. I would have all the fluid that was supposed to be running through my gland and through my vaginal tissues then all go into this cyst or this pocket, and it would just get bigger and bigger and bigger and bigger and bigger. And when you're 16, that's prime hormonal time. Like, I was not sexually active at 16, but that's prime hormonal time. So everything is flowing exactly how it's supposed to be flowing. And so I would have softball size pockets filled with fluid that would then get infected, and then the cysts would just continue, and I'd have to go get them lanced, which is terribly painful. And then I would have to eventually have surgery twice and have it completely removed. I went in for a 45-minute surgery that turned in for a 2-hour and 45-minute surgery, which left me depleted of oxygen, not able to get my oxygen back. And I think of it like this: those shows like ER or the doctor shows where like the crash cart is flying in and there's nurses and doctors running all over the place and the monitors are going off. That's what happened to me. I remember coming in and out of consciousness and seeing this chaos everywhere because they could not get my oxygen to level out. So I'm not a fan of anesthesia. It just doesn't work for me. It does not work well with me at all. And so I got these cysts, which then led to me finding out that I had lesions on my cervix. I had never had HPV. So at the time, in that era, late 90s, early 2000s, that was considered a medical anomaly because nobody could understand how you had lesions on your cervix, but you'd never had HPV. And then that led to a plethora of other things, which led us to me finding out that I had endometriosis when I was 23 years old. I forget what year that was, but I was 23 years old. So, 2010. 23 years old. I was told that I would never have children. If I got pregnant, I wouldn't carry to term because my endometriosis was so bad. And if I did carry to term, there was I can't even talk today. There was a very probable instance that I would have placental abruption, or me or the baby would die. And so at that time, the doctor that I was seeing said, don't get pregnant, ever. Don't do it. And I had just come off of Lupron, which at the time was experimental. You can take it 12 months out of the year, and then you have to skip 12 months. So you get a pain-free year and then a year of pain, a pain-free year and then a year of pain. But the flip side to that is the medication depletes your muscle mass to the point that your muscles can literally just completely atrophy and fall off the bones. And that is why you cannot take it. It will also affect your bones. So you are instructed to take a calcium supplement while you are taking it. And it gives you fake menopause. So I've already been through menopause once, and I get to go through it again when it's time. Within 30 minutes of taking the injection, the needle is so large that comes with it that the doctor changed the needle out because they were afraid it was going to be super painful. They have to mix up this concoction that's this very sick, just very thick, yucky substance that then goes into the body. If you get it injected into your arm, which I did because I was afraid to put it in my butt cheek, it then makes this big knot under the skin, and it's hot, which goes away within about a week. And you have to do that every quarter of the year for 12 months. And they don't necessarily know that it'll work. If you don't have any pain when it's time for your period, you have endo. And if you do still have pain, then you do not have endo. And I did not have any pain for a whole year. It was like the newest lease on life for me. But I started to deplete in my health. I was losing my muscle mass. I was getting sick. My immune system was ruined. So I traded no pain for being ill and literally not being able to function. Um, so I went to a different doctor. And again, that doctor didn't have any options for me other than the ones that had already been laid out. And I was at this point was about 25. Finally decided, hey, I'm going to figure this out on my own then because there's other options. I know there's other options. I do not like what this is doing to my body. I do not want to live my life this way. Thus started my journey in learning more about the disease, learning more about the condition, learning more about the body, and learning how to create the program Divine Woman. And if you do not know me personally, I am happy to tell you that once I changed my diet, once I started supplementing, once I started doing what I needed to do for my body, I then conceived my first child in 2014. And he was born with no problems, no problem in the pregnancy at all. And after I had him, like most women that get pregnant after endometriosis, some, not all, endometriosis symptoms went away. And then, surprise, 2018, I found out I'm pregnant with my daughter. And that pregnancy was atrocious. I could not eat the entire time. I was very, very ill. I only gained 19 pounds. I had a subchorionic hemorrhage and was on bed rest for the majority of the pregnancy. And we actually had to have a discussion on whether or not we would be able to keep our child or I would be able to stay pregnant because the placental abruption that we talked about in 2010 was right in front of my face. And it was one of the scariest things that I have ever seen or witnessed or dealt with in my entire life. My daughter is here and she is fine. I did have a tubal ligation because I was very scared to get pregnant again. I didn't want to die. I didn't want to leave my children here without me. I didn't want to leave their dad raising 3 children without me. And I had a boy and a girl, and I was very happy and very blessed with that. And I realized that that is not everybody's story, but it is my story. And it's what led me to create Divine Woman because I realized that it was more to it than just hormonal imbalance. It was more to it than just endometriosis. A lot of us have gone through some type of abuse, whether that be sexual or not in nature, but it was trauma, abuse, assault of some sort. And we would take that and we would put it in to the body and just kind of soak it in and never talk about it and never deal with it. And it became trauma. And it became trauma that we didn't release, which then presented as disease in the body, which then, ironically enough, affected all of our reproductive organs and our reproductive cycle and our menstrual cycle. And then I started to put together that there were certain things that could help us that people weren't talking about, like DIM13C. It is something that you naturally produce in the body, and we don't produce enough of it. Our diet keeps us from producing enough of it, or if we do produce enough of it, our diet prevents us from being able to assimilate it to the body. Lots of us were intaking or ingesting estrogen-laden foods, so milk, dairy, caffeine, alcohol, all these things that were causing our estrogen to spike because they were phytoestrogens. And we didn't know that we should limit those things because no one told us that. Taking things like black cohosh if you're perimenopausal or if you have endometriosis. There are mixed opinions in the functional medicine world and also the regular medical world about black cohosh because some people think you should only take that if you're menopausal. But if you're perimenopausal or someone with hormone imbalance or someone with endo, it actually works very, very good for you because it helps to bring the estrogen level down. Wild yam. Natural progesterone comes in a cream. You can even get it lavender scented. You rub it on your chest, your abdomen, the sides of your thighs. Helps bring the estrogen level down and bring the progesterone level up. And it's natural. It's not something that's considered hormone therapy, even though it's a hormone. Another great thing would be chasteberry or Vitex. Helps to bring those estrogen levels down. And what we automatically see when we talk about the estrogen levels being too high is that your kidneys cannot then flush out all the extra estrogen that you have. So it just stays there and it stays in your body and it goes back in your bloodstream and it causes your estrogen levels to be very high. And sometimes, even though they're high, when we get a hormone panel through blood work, it either doesn't show or the level's not high enough on the spectrum for them to do something about it and put you on hormone therapy, but it's still too high for your body because everybody's body is different. And if you're presenting with something like endometriosis, it is too high for your body because endometriosis is an abnormality. It is not something that is normal and that should be happening to the female reproductive organs or to the other organs within the body. It shouldn't be happening to us. And so endometriosis, slippery slope. It's very frustrating for women that have it. And I created Divine Woman with estrogen dominant and endometriosis sisters in mind, but it's for anyone that has hormone imbalance, that has any of the things that we listed earlier, like the PCOS and the PMDD and the heavy uterine bleeding and the thyroid issues or the diabetes or insulin resistance, because lots of times insulin resistance, whether you're diabetic or not, and endometriosis and also estrogen dominance go hand in hand. And so there's just a lot of things that popped up for me, and I created a 12-week program that we talk about all these things. We talk about trauma. We talk about birth control use. We talk about supplements that should help you that reduce your estrogen load. We talk about foods that you should eat, protocols that you should stay on for the rest of your life if you do not want to continue to have this condition plague your life. Am I saying that I can make you 100% better? No, I can't make that guarantee with anybody. Can I? Am I saying that I can help you? Most likely, if you listen to me, if you trust me, if you follow along with the protocol that I give you. And I'm actually right now building a second protocol that comes after the program that are a different round of supplements that are help you to maintain from the ones that we take in the program. The program includes 12 weeks of content, a wellness journal, all of your supplements, text content, video content, and then coaching calls about every 2 weeks with me privately. And it's a really great way to bring women together and to create a community and to help people that are dealing with estrogen dominance and endometriosis and any other hormone imbalance related condition. It's one of my favorite things that I do. I really enjoy being able to show women just how sacred they are, because that's another like huge pinpoint in Divine Woman is us knowing how sacred we are. So we've taken in this trauma, we've kept it in, we aren't taking care of our bodies as far as food is concerned. Most of us don't have a healthy relationship with food. We're ingesting things that are making us keep our estrogen high. We don't know the supplements to take. We feel like we're out of options. We feel like we don't know how we're going to make it. And then something like that comes along that does show that you can actually be successful at being healthy and being well and managing a condition that you were once told that you would never ever be able to do anything with outside of hormone therapy or hormonal birth control. I haven't been on birth control. I didn't get my tubal until I was 32. So I haven't been on birth control for probably about 10 years because it just wasn't what I wanted to do for my body anymore. And I understand that there's a lot of people out there that feel like that. And so when I talk about endometriosis and I talk about hormone imbalance, the biggest thing that the takeaway from this is that I need you to know that I understand on way more than a clinical doctor of functional medicine level. I know from a personal level. I have battled with this for 20 years and have finally gotten to a place in my life where I am able to not only be okay and not have severe pain and bleeding every month, but I'm also able to guide other women and show them how to do this too. And so that just brings a lot of joy to my heart. That's my story. That's my program. That's what I have on endometriosis. If you're like me, you've already done a million years of research and you know where you stand. Again, if you are watching this video live or you're watching it on the replay, please go to the comments and say me and shoot me your email address, because I would love to give you my self-care guide for hormone balancing. It's going to talk about some of the things that we talked about today in there. It also has infographics and a couple of trackers for like hydration and different things like that. It talks about endocrine disruptors, which is a big thing for people who have endo, because you really can't do anything that's going to unbalance the hormones. So this is going to be, chemically laden lotions and perfumes and the foods that we eat, things like aspartame or sucralose, different things of that nature. And it talks all about those in there. That's in there as well. And then there's my own thoughts on spirituality and trauma release and how we deal with trauma, as well as ways to reduce stress and to have self-care that are inexpensive. I realize everybody's not at a point where they're able to buy a program. And so I like to be able to give you something, one, for joining me because you spent your time with me today, and something that's going to be very beneficial for you at no cost, because I don't feel like everything should cost money. If we can start you on a journey to help you get well, and maybe, you come on as one-on-one coaching instead of a program, which is a little bit, the pricing is a lot different. You know, we just start there. And so it's just my goal to be able to inform people what's out there and that you do have options when it comes to conditions that make you feel like you have none and that you're out of them. I know what it's like running around from OBGYN to OBGYN and not getting any type of response that is going to help you. It's frustrating and it's damaging, and it literally puts you sometimes in a state of depression because you feel like this is going to be your life until you die. And if not to over exaggerate, but some of us get to the point that we'd rather just die because we don't want to live with what happens to us every month just because we're a woman. And that's where I come in to let you know that you're special and that you're sacred and that your womb is sacred, even if it seems like it's not operating correctly and that it seems like it's damning you, that you're still special and that you're still sacred. And for you to take that power and to use it to heal your body is such a beautiful experience, both for me as the practitioner and you as the client. So I have enjoyed talking about endometriosis with you today. Don't forget to join us next Wednesday for another live video where we will talk about another topic dealing with women. We're going to talk about tubal ligations and how everyone thinks that those are safe and that they don't mess with your hormones. I got another story for you. It's going to tell you something just a little bit different. And for some of you, it's going to show you all those sneaking suspicions that you've had. You are absolutely correct. So thank you once again. I appreciate you guys. This series is bringing me joy. I love being able to talk to you and be with you like this. Thank you so much for joining. And again, don't forget to put me in the comments, DM me. Whether it's personal page or business page, either one is fine. DM me your email address and I will get out my self-care guide to you. It's 40 pages, free of cost, just for being here today. Thank you guys so much. I will see you later. Have a great day. Bye.